Missionary Dr. Beryl Howie started the OB Gynae Department at the Ludhiana Christian Medical College. When she died, the Ludhiana Christian Medical College Board USA asked Director Dr. Thomas for a suggestion of an appropriate memorial gift in her honor and in her memory. When a laparoscopic set for the OB Gynae Department was suggested, fundraising began.
I was here as a medical student when Dr. Beryl Howie was heading the department, and she was a great teacher and a very wonderful doctor and very good human being on top of all, and we really remember her very fondly. So we don't have a full operative set at present, so it will be a great help for us in doing laparoscopic surgery for the patient, as well as training our postgraduates so that they can also learn in future for the laparoscopic surgery. So we'll be very glad to have it.
When North American Alumni President Dr. Elizabeth Paul got behind the project, things really moved. The funds were raised, the laparoscopic set was purchased and dedicated when Dr. Elizabeth Paul and others were in Ludhiana. When I was in Ludhiana last month, I stopped by the OB Gynae Department to learn about the laparoscopic set. I was delighted with what Dr. Sophia had to say.
So you were asking me about the laparoscope. Very happy with your laparoscope because we are really doing almost all patients. When I say almost all, that means previous so many surgeries also, if they come with previous cesarean sections or previous surgeries, usually where there will be lot of additions and people are a little hesitant to use laparoscopy. Even for those patients we are doing, what we have started doing is, what we have made a decision is, we'll do everyone laparoscopically, and in case there is a problem or suppose lot of addition, absolutely laparoscopically we are not able to do, then only we open up. That is, and we have to open up very rare. So all the hysterectomies, we are doing lot of surgeries laparoscopically. So the hysterectomies, that is the removal of uterus. Then we have all these ectopic pregnancies where the pregnancy is in the tube and all. Even the ruptured one, the unruptured ectopic, and even the ruptured one we are doing laparoscopically now. So these are the two main bulk of the surgeries which we are doing. Other than that, cystectomies and all that, the ovarian cysts and all, almost all we are doing laparoscopically because laparoscopically we were knowing, but once you start using only that learning curve starts. So initially we had some difficulty, but all that problem is gone when you see the patient post-op, because their post-op pain and their recovery and their discharge is so happy and fast that they are really happy.
Wonderful.
Yeah.
Thank you very much.
The incision will be a long one, the pain will be so much, even the recovery will be so late that even if you want to discharge early, it used to be 6th day or 7th day or 8th day, the open hysterectomies. And for a laparoscopic hysterectomies, we are usually discharging them by 3rd, maximum 4th day. So that's why you find very less patients in the ward. If you think that less patients of laparoscopy, because they are getting discharged, not because it's less done, but they are getting discharged so fast. By 2nd day she's sitting up, and hysterectomy you really don't expect them to be sitting up 2nd day or eating for that matter. And plus the pain of the post-op pain, because it's all that post-op in sutures and all that. So the patient will have so much of inconvenience. For laparoscopy, the next day they are sitting up and smiling. Sometimes even change their dress, OT dress, and so nice. Their patient post-op pain, this thing factor is a very rewarding one.
Thank you.
Sometimes you have to really struggle, especially the attendant, because now we have only one TV screen that we were asking this thing from a long time. The laparoscope screen, we have only one. So if the assistant also, what happens is, it's usually at the convenience of the main surgeon. So the assistant one has to really bend like this, and because you have to keep an eye on the screen and also assist here.